Welcome back, and welcome back to 2017. My name is Jeffrey Davis. This is Radio Entrepreneurs. And I'm really glad to say we're being hosted, by our friends at MTP Software and the Social Scene over in Natick, Massachusetts. Thank you very much for your great hospitality. My co-host today, the wonderful and very talented David Soper.
Hey, Jeffrey. Happy New Year to you. How are you?
Good, thank you, David. How are you?
Good. You look tan and rested. Did you go somewhere warm?
Of course I did. Either that or a tanning tank. David, you look like you're the only person that didn't gain weight between Thanksgiving and Christmas.
Oh, I'm sure I gained a few pounds, but thanks, Jeffrey.
Yeah, well, a pound and a half doesn't count. Our next guest is Bill Walczak from South End Community Centers, or Center.
Community Health Center.
Welcome to the show.
Yes, thank you.
Do you want to talk to us about and explain to us first about South End Community Center?
Well, it's first of all, it's a community health center, and health centers that are in areas, urban areas, are medical facilities. Oftentimes in the suburbs, they're like gyms where you work out. So I often get that question out in the suburbs of, oh, do you have Nautilus? And it's like, no, we have doctors. So, but health centers were set up back in the 1960s. It was actually a product of Ted Kennedy, who one of his first victories, actually, after becoming a U.S. senator, was to establish a way that when the marketplace couldn't take care of low-income people in the healthcare world for healthcare services, they needed to figure out a way of providing healthcare services. So rather than patients going to an emergency room where you couldn't get turned away, in 1965, the first community health center in America was started. It was actually modeled after a South African project in what was then called the homelands of Ciskei, I believe. But it was the idea was the government would subsidize independent nonprofit organizations to provide medical services in low-income communities. First one in America was in Dorchester at the Columbia Point Housing Project. Second one was in Mississippi at Mound Bayou in a rural area. And from there are now 1,600 of them in the country, and about 40 million Americans are served by community health centers.
So if I were to walk in or drive up and then walk into South End Community Center, what would be the impressions I would have based upon my experiences with healthcare?
It looks like a group practice, like a medical group practice. What you'd notice, though, is that there are a mix of people. A lot of group practices, you go out and it looks like the community they're in the South End, which is a very interesting community that's made up of both wealthy people and low-income people. It's a mix. So see a lot of people who don't speak English, but you'll also see people who are look like upper middle class people that towing their children there. So it's a medical facility, and there's a lot of different kinds of services as well. We have about 15 physicians on staff and maybe 7 or 8 nurse practitioners. And then we also have a large behavioral health department with psychiatrists, psychologists, and social workers. We have eye care, optometry, ophthalmology, and opticians. And we also have a dental program, a large dental program. But it was set up so that the low-income folks of the South End, who were generally living in housing projects, could have a place where they could go where that wasn't an emergency room to get basic primary care.